Tuberculosis, TB. In this video, I will discuss the causes, symptoms, treatment and prevention of tuberculosis. What is tuberculosis? Tuberculosis, TB, is a contagious infection that usually attacks your lungs. It can also spread to other parts of your body, like your brain and spine. A type of bacteria called Mycobacterium tuberculosis causes it. Can tuberculosis be cured? In the 20th century, TB was a leading cause of death around the world. Today, most cases are cured with antibiotics, but it takes a long time. You have to take medications for at least 6 to 9 months. Tuberculosis types, a TB infection doesn't always mean you'll get sick. There are 2 forms of the disease. Latent TB: you have the germs in your body, but your immune system keeps them from spreading. You don't have any symptoms, and you're not contagious. But the infection is still alive and can one day become active. Your doctor will give you medications to prevent active TB. Active TB, the germs multiply and make you sick. You can spread the disease to others. 90% of active cases in adults come from a latent TB infection. A latent or active TB infection can also be drug resistant, meaning certain medications don't work against the bacteria. Tuberculosis signs and symptoms: latent TB doesn't have symptoms. A skin or blood test can tell if you have it. Signs of active TB disease include a cough that lasts more than 3 weeks, chest pain, coughing up blood, feeling tired all the time, night sweats, chills, fever, loss of appetite, weight loss. If you have any of these symptoms, see your doctor to get tested. Get medical help right away if you have chest pain. Tuberculosis causes: tuberculosis is caused by bacteria that spread through the air, just like a cold or the flu. You can get TB only if you come into contact with people who have it. Tuberculosis transmission: when someone who has TB coughs, sneezes, talks, laughs, or sings, they release tiny droplets that contain the germs. If you breathe in these germs, you can get it. TB isn't easy to catch. You usually have to spend a long time around someone who has a lot of the bacteria in their lungs. You're most likely to catch it from co-workers, friends, and family members. Tuberculosis germs don't thrive on surfaces. You can't get it from shaking hands with someone who has it or by sharing their food or drink. Tuberculosis tests and diagnosis: there are 2 common tests for tuberculosis. 1 skin test. This is also known as the Man-2 tuberculin skin test. 2 blood test. These tests, also called interferon gamma release assays, IGRAs, measure the response when TB proteins are mixed with a small amount of your blood. Those tests don't tell you if your infection is latent or active. If you get a positive skin or blood test, your doctor will learn which type you have with 3. A chest X-ray or CT scan to look for changes in your lungs. 4. Sputum test. Acid-fast bacillus, AFB, tests for TB bacteria in your sputum, the mucus that comes up when you cough. Tuberculosis treatment: your treatment will depend on your infection. If you have latent TB, your doctor will give you medication antibiotics to kill the bacteria so the infection doesn't become active. A combination of medicines also treats active TB. If you have drug-resistant TB, your doctor might give you 1 or more different medicines. You may have to take them for much longer, up to 30 months, and they can cause more side effects. Whatever kind of infection you have, it's important to finish taking all of your medications, even when you feel better. If you quit too soon, the bacteria can become resistant to the drugs. Prevention of tuberculosis: screening those at high risk, treatment of those infected, vaccination with Bacillus Mycobacterium, BCG,